Hello, wonderful person. This is Philip, and I noticed that there is a lot of interest in the video that I did yesterday, suggesting vitamin C might help with an infection, especially with a viral infection. There is another vitamin that is actually proven, and that is a mainstream study. So scientists, doctors are not going to deny this. It is proven that if you supplement 4,000 international units of vitamin D a day, that significantly reduces your risk of getting infections from a cold virus. Now, for those of you who don't know, the biological agent that was recently released, the COVID-19 thing, is the common cold. It's a different version of the common cold, but it's the same type of virus. So it stands to reason that if you supplement vitamin D, you're going to lower your risk of getting that infection also. Obviously, there isn't a study on that novel coronavirus yet with the vitamin D, but why not? It can't hurt to have a little bit of vitamin D as a supplement in your diet. Now, there is a caveat to that. If you take too much vitamin D, it can actually hurt you a little bit. So the optimal thing would be to check with your doctor and have your vitamin D levels monitored so that you don't overdo it. But because I don't like going to doctors, I instead did some online research a few months ago, and I found out that there is at least one study that proves that long-term supplementation of 10,000 international units of vitamin D per day does not have any negative side effects. So even though that's a pretty high dose to do long-term, 10,000 units per day, that still wouldn't have any negative side effects. So if you do 4,000 a day, you should be fairly safe. Now, in case of doubt, talk to your doctor. There are two more things that I would like to say about vitamin D. First, vitamin D is a fat-soluble vitamin, or soluble in oil. It's not going to be soluble in water. So when you take vitamin D, you should take it with a little bit of oil. Some vitamin D supplements come in a capsule that is filled with oil, so that's going to be okay. My vitamin D supplement, which I'm taking at the moment, have been taking for several months, is a powder. So what I do is, it's a powder inside of capsules. What I do is I open up the capsules, put them in a little bit of oil and mix that whole thing up, and then I swallow the oil with the powder in it. I figure that the powder form is probably more stable, has a greater shelf life than the form of vitamin D that's already dissolved in oil. But at the same time, if I put it in oil right before I take it, it'll probably increase absorption because vitamin D is oil soluble. Now, I haven't read any specific studies on that, but it just is common sense. And that little bit of oil, the little bit of olive oil or flax oil that I take with the vitamin D is not going to hurt me. So that's how I do it. And the other thing you should be aware of is that it takes several months for your vitamin D levels to change. Vitamin C, which I talked about in my video yesterday, is totally different. That works within minutes. Vitamin D literally takes about 3 or 4 months if you are deficient to get your levels back up. So you have to take it for a while before it takes full effect. But of course, if you haven't been taking it, why not start now? At some point it's going to help, and it's not like you have to wait 3 months before it has any effect at all. It's going to start having an effect, but you just have to realize that, as is the case with most fat soluble vitamins, vitamin D is a little bit slower to take effect and to accumulate in your body, to build up to the correct level. By the same token, if you have too much vitamin D in your body, it's going to take a while for your body to get rid of the excess, but that's another topic. So I just felt like mentioning this because lots of people have sort of heard of vitamin C for infections, but not all that many people know about vitamin D, and that it is actually scientifically proven. That's scientific consensus. That's not people like myself who are looking at studies from 50 years ago. That's nowadays, doctors will admit that if you have vitamin D supplementation in your diet, you're going to reduce your chance of getting an upper respiratory tract infection. So that's another point that I wanted to make. Then, of course, there is also at least one other nutrient that you should look into if you're interested in decreasing your chance of getting an infection, and that is zinc. The best form of any mineral is usually a chelate. So if you can get chelated zinc, that would probably be best. But again, do your own research. and I hope you stay happy and healthy, and you have a beautiful day.